So I have no conflict of interest to report. The aim of our study was actually to find a non-invasive predictor for Detrusor underactivity, which is something that we are not the only one looking for that. So we start to enroll patients with urinary tract symptoms and benign prostatic enlargement. For all patients, we perform urodynamic pressure flow study, transrectal ultrasound for prostate, and we measure bladder wall thickness with ultrasound, uroflowmetry, and IPSS score for the symptoms. Moving to results, basically what we found is that we have 43% of patients inside the group with Detrusor underactivity. We found that the Detrusor underactivity was related with a lower Qmax on the uroflowmetry and a lower bladder wall thickness. We confirm the relationship between bladder wall thickness and a lower Qmax as a predictive factor of Detrusor underactivity, and using statistical regression analysis, we perform a nomogram. The accuracy of the nomogram was 0.82, so it was pretty good a nomogram. And using this nomogram, we confirm, in conclusion, we confirm that both a lower bladder wall thickness and a lower Qmax can non-invasively predict the Detrusor underactivity in patients with LOTS due to benign prostatic enlargement. Thank you.
Any questions from the floor? Andrew Gummy.
Thank you very much, Andrew Gummy from Bristol. Did you take out the Detrusor overactivity from your analysis? Because greater bladder wall thickness occurs in that group, so it may confuse your results.
We did have the question over the... we did ask the patient, but we did not report under the last analysis because we didn't have the report for all the patients. So since we prefer to analyze just the data that we have complete for the patient, we exclude the overactivity data because they were not enough for all the patients. Okay. I know that
it will need removing.
Yeah, we definitely need. So that's the point. We are moving to a larger study and we are including more parameters. Now that we know where we should go, we are including more parameters to make sure that next data will be more interesting.
Okay.
Amy Dobberpool, United States. Very interesting work. I'm just curious, how did you account for bladder filling during your measurement of the bladder wall thickness?
Yes. So that's the part that the patient doesn't like that much, but we try to standardize. So we look for filling around from 200 to 200 to 250, and so that was done with a sterilized catheter for each patient. So that's the part that it was not really well appreciated for the patient, but it was part of the study. They accepted the whole package. Thank you.
Yes, I have also a small question. We did some work on bladder wall thickness in obstructed bladders, and it's kind of the same. And we found it very difficult between different investigators to have the same accuracy. Did you have the same problem?
So we only have two centers that join the data, so that should reduce the number of investigators. We select one investigator for each center that repeat for those two men who does the the ultrasound, and they checked with the same probe. So we try to limit the damage. I mean, to limit the difficulty of that. But yes, there is
it's not
especially with the probe. So we suggest to use the linear probe, but it's not always available all around the world.
Okay, thank you.
Thank you.